Good morning. I'm William McBroom, Director of Conference Sales at the St. Augustine, Ponte Vedra, and the Beaches Visitors and Convention Bureau, and the Program Director for the Chamber's Tourism and Hospitality Council. I'm your host and moderator for this morning's panel discussion. Today's virtual discussion is hosted by the Tourism and Hospitality Council. On behalf of the Tourism and Hospitality Council, welcome. We are pleased to bring you this timely discussion, COVID-19 exposure and the impact to your business. While today's virtual discussion is hosted by the Chamber's Tourism and Hospitality Council, we are acutely aware that the coronavirus pandemic has impacted and continues to affect businesses across all industries, locally, statewide, and nationally. We hope that this morning's discussion will be helpful not only to our local hospitality and tourism businesses, but also to our local businesses in the professional services industry, manufacturing, healthcare, retail, and other industries. This morning, I have the pleasure of moderating a panel of distinguished experts who will share their insights and answer your questions. Without further delay, let's meet our panelists. Today, we are joined by Nicole Chapman, the Regional Director of the Northeast and Florida Inns Chapter of the Florida Restaurant and Lodging Association, FRLA. FRLA is the state's premier hospitality trade association working to protect, educate, and promote Florida's $108.8 billion hospitality industry, including 1.4 million hospitality employees statewide. Nicole joined FRLA in 2017 and was involved with the merger of FRLA, North Florida Hotel and Lodging Association, with the Florida Bed and Breakfast Inns Association. Before joining FRLA, Nicole managed the convention services team at Visit Jacksonville. Nicole, we're so glad you could join us today.
Good morning. Thank you, guys. Looking forward to it.
Great. Thank you. I also have the pleasure of introducing Gary Wheeler. Gary is a partner with the law firm Costangi, Brooks, Smith & Profit, LLP, and serves as a director on the Chamber's Board of Directors. He has represented employers exclusively in both the private and public sectors for over 20 years. Gary has successfully defended a variety of employers in all aspects of labor and employment law. He is a frequent lecturer at seminars for employers and provides in-house training on workplace issues to supervisory and management employees. Gary, thank you very much for joining us.
Thanks, William. Thanks for having me.
Thank you for being here. Finally, I'm pleased to introduce Chamber member Michael Schmitz, Vice President of Talent Optimization with Workplace Synergistics. Michael is a certified talent optimization consultant with the Predictive Index and has 25 years of marketing and sales experience, including 17 years in higher education, software, and publishing. Throughout his career, he has helped launch multiple new products and services and assisted in transitioning the companies he worked for from traditional print publisher to digital software and services provider. Michael, welcome.
Good morning, all. Thanks for having me.
Thank you, Michael. Before we begin the discussion, I would ask that our audience submit your questions to us at any time using the chat feature. We will field questions throughout today's discussion. Now, there are some recent regulatory actions that we would like to address which impact businesses both locally across the state and nationwide. At this time, I would like to ask Gary Wheeler to highlight the most recent local regulations as well as federal legislation passed in response to the COVID-19 pandemic that our employers should be aware of. Gary, to you, sir.
Thank you. Well, first I want to just cover the City of St. Augustine's administrative order that was passed on Friday regarding the mandating of face mask in indoor spaces. So I'm going to cover the actual text of the order just so you're aware. I'm not going to read the entire order, but I do think it's important because when you hear about the order, could be some confusion about how broad it is, how it impacts business owners. And so hopefully this will answer some of those questions and we can cover those, cover any questions you may have today. But I'm just going to focus in on the meat and potatoes part of the resolution. And here it is. Every person working, living, visiting, or doing business in the city of St. Augustine shall wear a face covering in any indoor location other than their home or residence when not maintaining social distancing from other persons, excluding family members or companions. The second part, nothing herein shall require or allow a person to wear a face covering so as to conceal the identity of the wearer in violation of Chapter 876 of the Florida statutes. And then finally, all businesses are encouraged to prohibit entry of any person who is not wearing a face covering, with the exceptions of those listed persons. Now, there's a list of 11 exceptions, and I'm not going to go over all 11, but I will read a few just to give you a flavor of what those are and encourage you to go look up those exceptions when you have time. Persons under the age of 2 years old, persons exercising while maintaining social distancing, persons eating or drinking. So those just 3 of the 11 exceptions. And as you've heard me say, with businesses are encouraged to prohibit anybody from entering into wearing facing. So the city is encouraging businesses to help them enforce the order, but it's really up to the businesses to make that decision on their own whether they're going to accept that encouragement or not. And so that's the first. The second two I'll just briefly mention because one, there was the St. Johns County Board of County Commissioners had a vote yesterday and rejected expanding that similar language countywide. Tomorrow, the city of St. Augustine Beach is expected to have a vote on this similar kind of provisions. So, I don't want to cover those because one didn't pass and one has yet to come up for a vote, but the one that's been implemented, as you can see, has many exceptions, and as far as business owners are concerned, only encourages businesses to help the city enforce the provisions. So now on to the federal, and if, in the kind of vein of 2020, this seems like old legislation because it's been around since March 19th, which in 2020 measurement seems like about a year and a half ago. But now we've had more experience with this and can say that this is more applicable. And we're seeing as people are getting back to work, the provisions of this are now really becoming more important. This is the Family First Coronavirus Response Act, and its provisions deal with, well, what happens when we have employees who are required to miss work or need to miss work because of some kind of COVID-19 reason. And then this covers that scenario. The Family First Coronavirus Response Act was signed into law on March 19th and contains 2 key provisions that require some employers to offer paid leave to employees who can't work or telework for specified reasons. Now, this law will only last through the end of this year unless it's revised and expanded. The paid leave provisions apply to any private sector employer with fewer than 500 employees and virtually all public sector employers. Private sector employees who provide leave by the Family First Coronavirus Response Act are entitled to payroll credits to cover all the expense associated with paying these benefits. The Emergency Family Medical Leave Act allows employees to take paid leave to care for a son or daughter who is home because of a school or child care closing or because the child care provider is unavailable. Employees can take up to 12 weeks in a rolling 12-month period, and after the first 2 weeks, leave is paid at 2/3 the employee's regular rate or up to a maximum of $200 a day or $10,000 total. The Emergency Paid Sick Leave Act provides up to 80 hours of paid leave for 6 coronavirus-related reasons. I'm not going to go through all 6 of those, but those do include if an employee is required to miss work because of some local quarantine or isolation order, or the employee is advised by a healthcare provider to self-quarantine because of COVID-19. So those provisions can be triggered, and they can work together, because we have, you could have somebody who needs to stay home to care for a child because that child can no longer go to school or no longer go to the daycare that the parent had planned. And for the first 10 days, that would meet one of these provisions and would allow that employee to be paid for 80 hours. If that need still exists after that 2-week period, for an additional 10 weeks, that employee would receive partial pay under the provisions that I spoke of, which is 2/3 of their pay up to $200 a day. So, and these provisions that I've just covered, are available by the Department of Labor, and you can get a poster, and you'll need to post that where you post similar type labor and employment laws in your break room, or, you can disseminate that through email to all your employees. So anyway, but thank you, William.
Thank you very much, Gary. I didn't see any questions on the chat right now, but we can come back to that later. So I understand some of you may well have questions about that. So thank you very much for that update. Now I'd like to ask Nicole Chapman to brief us on the most recent Department of Business and Professional Regulation emergency order impacting the hospitality industry specifically. Nicole?
Absolutely. Thank you guys for having me here today. I wanted to touch on the masks. Obviously, enforcement is the question we're receiving a lot of. How does the business enforce these things when it's not a enforceable action by calling the police department? So one of the slogans we have come up with is no shirt, no shoes, no mask, no service. So think of instituting a fun tagline. I've seen a lot of great St. Augustine, St. Johns County businesses having some fun taglines and some play with that. I also see the great social media praise in the businesses that are following these recommendations and guidelines. So keep that up. One thing we did want to suggest to everyone is really focus on taking all of these recommendations and implementing into your policy and procedures. Put them in your guidebook so that your employees know where your stance is as a restaurant owner and hospitality professional, so that they can easily have that information saying, absolutely, we are on board with these rules and recommendations, and then also have the information available to share with your patrons if they do ask, because people are asking now more than ever which restaurants are complying with the recommendations and following CDC guidelines. I know St. Johns County's got some great programs down there to incentivize everyone with the pledge, and we think that is a wonderful thing. So keep up the great work on that. Going into the DBPR ruling that came out on Friday, it's really fun when they use Twitter to announce something, and then we all have to figure out what the definition of a bar is this week. So there was some information shared originally, which is kind of going back to phase 1 a little bit, stating that the bars must close if you serve over 51% in sales. Bars must close, but you can still operate for to-go, so selling those beverages in the closed containers to go. So that is where that lives. There was some confusion from some DBPR and ABT officials to the police department. We have since got that clarified, and I just got an email this morning that the corrected 100% verbiage is now posted on the DBPR executive order site. So I'm going to read a snippet from it. It just says, vendors licensed to sell alcoholic beverages for consumption on premise, but not licensed to offer food service, shall suspend sale of alcoholic beverages for consumption on premise, provided that these vendors may continue to sell alcoholic beverages for consumption off premise. So that's the big language there. And this is different than a governor's executive order, because it is through the Department of Business and Professional Regulation, their emergency order 2020-9. So know that that information is there. If you guys have questions or concerns on it, please follow up with me. I'm happy to help get those answered for you. And just a mask reminder, guests should wear masks when they walk into your establishment. Once they sit down, they can remove them because at that point they are socially distanced because you guys are already following those recommendations and mandates for that. So that is a snippet on that. And if there's any questions I can answer now, but happy to help answer questions as you guys have them.
Well, thank you very much. I'm sure people on the call will have questions. I don't see any yet, but I would encourage everyone attending to think about it, because I do know from the calls we field here that it's really not clear in some areas. And Nicole is an expert, and our other experts here can help us understand all of this. So seeing no questions right now, we'll go to so the general discussion. I'll start with Gary, if I may. Gary, what constitutes exposure when considering coronavirus?
Well, the CDC guidelines talk about exposure as being within 6 feet for 15 or more minutes. And when you think about that, it's a significant amount of exposure. So, the difficulty sometimes is, there's a 14-day reach back period where, so if somebody tests positive for COVID-19, the inquiry by the employer or anybody affected should be, okay, who has this person had contact within the last 14 days? And remembering that you saw Bob 7 days ago, it may be more difficult to determine how closely you were situated to Bob and how long your conversation was with Bob. Was it 6 minutes? Were you, so, in theory, it sounds like it's not going to trigger that many people, but when you look back over a 14-day period, it can be very difficult to have that kind of recollection. So that's one of the issues with regard to it. And then there's also some asterisks from the CDC about basically saying, well, this is a guideline, and it could be different. I mean, just take an example. If you're in a bar where the music is blaring, you may elevate your voice, and as we've heard, singing or elevated voices probably projects, raises the danger a bit. And so somebody who was 6 feet away for 8 to 10 minutes may, decide, well, that's not a risk I want to take. And the business owner may agree, and they may say, well, we're going to treat that person as having exposure, even though they don't meet the hard definition of CDC because of those asterisks in there. So, it's an interesting question, and one I'm afraid we're all going to have to deal with over the next coming weeks and months.
Okay, thank you very much for that. Yeah, I can see there'd be a lot of variation in there, but good to know. Thank you. For Nicole, what steps do I take when the business has been exposed to a positive case or one or more employees test positive? And we'll start with you and probably see if Gary or Michael has something to add there too. Nicole,
Great.
what?
Well, thank you, William. And obviously this is a hot topic that I'm getting questions on all hours of the night. I was on the phone last night with a restaurant at like midnight, helping them. So know that FRLA hosted a webinar that went into detail about an hour and a half last Friday. And I know after this call today, they'll share that with you guys. So you can see some of the expert opinions in that. We also had a labor and employment lawyer on it, but we also had a restaurateur answering some questions on what they're doing. So some of the big things you need to do is, as a hospitality owner, is sit down, read these CDC guidelines, understand them completely. And as I mentioned before, go back and implement these into your operating procedures. That way, when, it's not a question of if, it's a question of when someone at your business that works there is exposed, you are ready to go and ready to answer their questions. Do remember in the Executive Order 2020-68, we have those rules daily that you need to ask your employees for screening in a restaurant. So just remember that falls into this as well. One of the biggest questions I'm getting now is, do I need to shut down and do I need to tell the world what has happened? The answer is that's your business decision. Do you need to shut down if your kitchen staff has been affected to do a deep cleaning? Yes. It's also hard to open a business when all your employees have to go get tested when you have no employees to work. So the biggest guidelines is to, once this information is known, you cannot share with your other employees that Susie has COVID. You can just say, we have an employee, don't forget the HIPAA laws there. Encourage your employees to get tested. Obviously, all the counties in our region have free testing available. It is taking a little bit of time due to the increase in testing to get results. There are some partners out there that can turn around tests a lot quicker. And that is up to you as a business owner if you want to help offset the cost of those testing for your employees. So we do encourage that if it's somebody in the kitchen that has tested positive, obviously they've been exposed to a lot of people in your business compared to somebody that might be on the floor in your business. So really it's a case-by-case basis that you need to, as a business owner, follow it, but do follow the CDC guidelines in those regards. But the biggest thing we're seeing is a closure for 24 hours with a deep disinfectant and having your employees get tested. If there is a positive employee tested, the mandate from the emergency order is they have to finish their COVID, get tested, then they have to go back and get tested and have 2 negative tests with a spacing of 24 hours before they can return to work. So do know that, and I'm sure Gary's got some stuff to add from the legality of it.
Great, Nicole, thank you. Gary, yes, from the legal side?
Yeah, I just wanted to kind of talk about the difficulty of kind of the HIPAA compliance. It's a balancing test. I mean, one of the things you'd like to do in this kind of situation is kind of backpedal to the principles and say, you know, as a business, what are we trying to do? Number one is protect our employees and our customers, their health and safety. But number two is protect, you know, the dignity and privacy of your employees. And that's, you know, that can be a difficult balancing act. And so we've seen in some of the businesses I've dealt with, you know, they've been very proactive about getting information about somebody having been tested positive for COVID and disseminating information to the customers in a proactive way about particularly shifts and time periods that the people worked. And many times there may be some additional information that can reveal, but not much more and then somebody will call and, you know, sometimes I've been able to give some common sense tips as they'll say, well, can't you tell me if it's a male or female? And depending on the facts and circumstances, you may not be able to tell that. If there's only, 3 or 4 servers that were working during that particular shift, revealing that information may be effectively naming the employee. And, that would be a prohibition. It's not, that you refrain from specifically, uttering that person's name. The prohibition is against, identifying that employee. And those facts and circumstances kind of depend on how much somebody can learn from that. And so it can be a little frustrating for a business owner who wants to be helpful to protect against the privacy. But, think about some other things that are available. It's not all on you as a business owner. You will have, the Department of Health coming back and doing contact tracing. You will have the employee that has the option of reaching out to people or answering questions that he or she, wants to share with other people. So it's not on you as the employer to, provide, total health and safety. That you have other partners and other people to do that, and you do have your limitations. So.
Okay. Thank you very much, Gary. Michael, from an HR perspective, how and what should I communicate with my staff? And Gary kind of hit on that, but I'd like to hear it from your side.
So we always take a people-focused approach when we work with our clients. And the word we've been using a lot lately is empathy. And even if your leadership style is to be empathetic, during these times, you may need to be even more empathetic than you're used to being. Your employees are, they're contending with a lot, not only social distancing, remote work in a lot of cases, so therefore isolation, but also extreme unsettling uncertainty. And, with the public health, an unstable economy, civic unrest. All these are weighing heavily on your employees' minds these days. And so to act like this isn't the case would almost be tone deaf and kind of disingenuous. So, and also you risk alienating yourself and other team members if you attempt to just go about business as usual, because it's not business as usual. So you as a leader, your leadership style, what used to work may no longer be appropriate. Where compassion and empathy might have been, I guess in your tool belt before, and you may have maybe deployed them on an as-needed basis, they should now pretty much guide your approach in most, if not all, situations these days. Ways to do that would be encourage people to, I almost want to say, be vulnerable and expressive. Take time to listen without you feeling like you need to have all the answers. People want to be heard right now. It never hurts to sprinkle in some fun, some humor when you're talking to your employees. Also, simply offer them a forum. A forum for conversation can go a long way, and it helps team members feel seen and heard and know that they're cared for. It'll also help relieve you of the need to always feel like you have to have an agenda or a rigid structure to the conversation. So we just encourage that extra bit of empathy, even if you already were empathetic, and that extra bit of understanding as we all deal with these times.
So thank you very much for that. And that's great. It's kind of going a little bit further. I hear from people in the industry that they're afraid to go to work. They're afraid they might get exposed. They don't want to lose their job. Is there anything you can share? I know that's a very difficult position, but is there anything you can share on that front?
And there is the trickiest part maybe of all of this, and that is a tough one. But I always go back to the managers or to the leaders and say, think about what it is that your teammates, your employees are going through right now. Think about things like who's sacrificing what? What else do they have going on throughout this pandemic? And what logistics does this new workplace entail for them? And then here's the most important thing, I think, well, two most important things really. How should I communicate to this person, based on their motivating needs? People respond to different types of communication. Some people are more extroverted. Some people are higher on patience. Some people are higher on more formality. So know your people and how to best communicate with them. But here's the most important thing, I think. You always have to ask yourself these days, and this is the direct answer question, is do I need to provide more context here? Is a quick note to my team enough? Or do I need to get my team on a Zoom and really let people express their concerns about this and their worries? And give them free access to, or give them open access, to their HR department if you have one, or just to a sympathetic ear. So the real answer is there's no one-size-fits-all answer to any of these questions. And that's what makes, I think, understanding your employees, not only their behavioral drives, but also their work styles, so important these days.
Great. Thank you very much for that. Yeah, difficult questions, all of them. And so I'm going to go to Nicole for a difficult one next. And then I think Gary can give us some legal advice on this, and maybe Michael's thoughts too. So let's say my business has been exposed to COVID-19. And let me take it a little bit further. Let's say it's a banquet, because in my end of the world here, and deal with conventions and conferences, and there are a lot of questions about those. How and what do I communicate with the customers, and to add a level? And what if I'm approached by the media inquiring about that?
That's a hard question. Let's just start with that. So we go back to the definition Gary talked to of exposure. So if you're a banquet facility and your staff is practicing social distancing and wearing masks, and a guest of the said event came back that they had COVID and you were notified of that, the biggest question is, who was exposed? Well, they were all in the same room together, absolutely. But you can go back to some of these big box stores that have had cases, and who was exposed there. No one knows if it was the stock boy that had it or the cashier to that. So you've got to go back to the definition of exposure. And that's where those barriers that you can take at banquets, put between the bar. Really be careful when you do buffets, if you do those at all anymore, especially past service. We don't recommend that because it's an airborne disease. It's very hard to know. So that's where that mask wearing is very important to follow, social distancing, barriers. So you've really got to take those into effect. If every business shut down every time somebody had an exposed known case, nothing would be open. So we've really got to make sure that your policies and procedures are in place of what happens. Follow those CDC guidelines. It's going to be different for everybody in every space. Just keep following that social distancing, because that's what we're really learning, that space between people is really helping people not get infected. So I'm going to go back to Gary to talk more about that exposure again, but I think that question really goes back to the definition of exposure.
All right, and then the press element. Let's say a reporter calls you up and says, "I hear there was a wedding at your establishment, and multiple guests were ill afterwards." How do you handle that?
And that's where you've got to have those FAQs ready to go at your establishment. So figure those out, that what your business is, what your stance is going to be on that. Are you going to close? Are you going to say, hey, we've got our staff properly trained or sanitizing and disinfecting between each group? And we suggest having a sanatorium person at your office, somebody in a vest maybe, that to the public is that person that's out there, making sure that, oh, they really are cleaning all the time and all those frequent touch points are touched. So just make sure you have those things ready to go, because as I reminded you earlier, it's not a statement of if, it's a statement of when this happens. And I'm sure Michael and Gary have some points they can add to the media side of it too.
Okay, well, thank you very much. Good answer to a hard question. Thank you very much. Well, yeah, let's go. Gary, you've had a moment to ponder the legal elements of that complex question. What do you have for us?
Well, sure. I think I've just observed some of the practices I've seen that I've read about from some folks who obviously have received some good advice from people that they've trusted as advisors on this. And, one of the things is, because of the limited information that can be shared, because we have to be concerned about the privacy of employees, and in certain cases, if it involves guests, the limited information that an employer may have, it's important to pat yourself on the back as an employer and go through the list of things that you are doing affirmatively to protect the employees in response to that. And whatever you can do to list that out and provide assurances is I think is helpful. In certain times you'd say, well, I don't want to, that seems kind of obvious. Well, it's very important, I think, to, provide that list of the things that you are doing, the cleaning that you're doing, those people that have been exposed, that you've sent those folks home, and that they won't be coming back into work until certain conditions are met, including a 14-day period and 2 negative tests. Whatever you're doing, emphasize that, and that'll help, I think, kind of absorb some of the your inability to provide information that the employer or the press may be prodding to get out of you, which would be inappropriate to share.
Okay, thank you very much. And as you say that, I was in preparing for this call, I was looking around for information locally, and I saw that Caps on the Water, the owner there, Bernard, had posted a video about all of their safety procedures and showing the cleaning, the wiping, the distancing. I would imagine that something like that shows in advance that you were taking all the steps would be helpful, right? Gary, I'm sorry.
Sorry, it definitely helps for consumer confidence. That's something we all have to go out there now. We all know, as good business owners, everyone's following the rules, but there's always those people out there that are kind of going right under the radar and doing the minimum. So every time you can boost that consumer confidence to get people to come into your establishments and share with their friends what a wonderful experience they had, or share that image, a positive message on social media, is always something really to look forward to.
Very good. All right, let's say, and I don't know who to pick on here. So let's say my business, Nicole, you're on. Let's keep on with you. You're experienced with your other call. So let's say my business was exposed and we shut down to sanitize and test the employees. Now we're ready to reopen. What should I do to ensure that we reopen safely? What steps do I need to take?
Well, if you sanitize, that's the biggest. Sanitize and disinfected, those are the biggest steps. So before you reopen, as I've mentioned multiple times, just make sure you have that policy and procedure in place for if it happens again. Unfortunately, we all know, say your business was sanitized and disinfected yesterday, you had lots of guests inside today. Who knows if somebody visiting your establishment did have COVID. So that inspection and testing and all that stuff is just as good as it was that day, might not be good today. So keep on top of making sure that you don't say, oh, we were sanitized and disinfected 2 days ago, we're good. Just make sure you still follow those procedures. And, as I said, many restaurants around town and hotels have got one person that's job is to walk around and continue to disinfect and sanitize those high touch point areas. It's always good. I know a lot of businesses after a confirmed case are posting, at the hostess desk, kind of like an FAQ of what we did, and here's the procedures we're taking in place. And I'd probably go to Michael next to give some HR insight into that regard, but making sure that you're sharing with your patrons all the positive things you've done to make sure their experience is safe.
Very good. So, well, Michael, you're on for your perspective on that question, please.
Well, yeah, and I was just going to say, I love that. I love a ton of things Nicole has said. I especially love how she keeps bringing up the FAQ idea. I think that's a brilliant idea. Make sure your employees are properly informed, whether it be, like she said, the FAQ for media inquiry or FAQ for customers. And so knowing that all employees may have a touch point with the customer and that they have the proper FAQs to answer any questions that customers might have. So that's fantastic advice. I love that, Nicole. I also love the video Bernard did on CAPS. I saw it a few days ago. I thought that was brilliant too. I mean, there are so many variables that accompany a given situation that, even the best laid plans get spoiled sometimes. And so how then do business leaders especially reconcile the expectation that they'll project confidence when the only real certainty of truth around the pandemic is uncertainty. So, the reality is we don't know and we can't predict what's going to happen overall, but we can at least be confident that we're doing the right things and make sure our employees are confident of that. And that's why I love Nicole's FAQ idea, and make sure our clients or customers are confident of that. And if we're confident that we're doing the right things, I think even that could be liberating. And we can also project confidence. We can project confidence while still being realistic, of course. And this can be unnatural for some people, but it's particularly important these days. Some people do find comfort in familiarity and process, and so being different than that can be scary. But of all times, to number one, admit that we don't have all the answers because we just don't know how it's going to go, but also just to know that we're doing the right things at our place of employment or at our business can be very liberating. Liberating is the right word, I think. But I can't emphasize enough how much I love Nicole's suggestions of the FAQs for all situations related to this, so all employees feel like they're part of the team and that they're properly informed.
Excellent. Thank you very much. A lot to unpack in all this. I guess this would be for Nicole again. I'm sorry, Nicole, but on the hospitality and restaurant side, should businesses sanitize themselves or bring in a third-party company to sanitize and disinfect?
Great question. That is a business decision. So let's talk 2 ways of this. So bringing in the third-party company can make your patrons feel great that you've utilized this expert company to sanitize your business. Often they give you a little sticker to put on your window that says, we've been sanitized, disinfected on this date, and all this stuff. It can be expensive. There are so many EPA certified products out there that sanitize and disinfect. If you're questioning at all, oh, is this sanitation or is this disinfecting? Hire the company. They have the experts there that know the difference of those. Many of these products that, we might spray at home, great. But you know what? Really, if you read the details on it, it needs to be left on the counter for 15 seconds, then wiped down. So making sure that if you are choosing to do it yourselves, you're following all the instructions to sanitize properly and disinfect properly. If you are confused or worried or not confident, like Michael mentioned, go ahead and hire that third-party company. But and you know what? When they're there, ask them the questions of, hey, thank you for coming and cleaning today. Tell me again, which product do I use for this? Which do I do for that? How long do they need to stay on the surface? And make sure you're following those informations, because we've all seen the red bucket in the corner that the hostess would wipe the table with and put it right back in. That might not be the best thing to do in this time of COVID. So just make sure that you understand that. There's a great list on the CDC website that links directly to the EPA certified products, to make sure you're just using them properly.
Thank you, Nicole. Great answer. I appreciate that. So one more question, and I think this will be for Gary. What conditions must be satisfied before we can allow an infected employee to return to work? Gary, are you still with us?
Well, again, yes, I'm here. And now these are based on guidelines, and now OSHA, which is the federal law that provides guidance with regard to workplace safety, doesn't have hard, fast rules regarding this. However, Nicole really touched on some of the best practices that, if you veer away from that, even though this is a relatively new disease and pandemic, is that, there's some risk involved in that. And so, what we've seen is, 14 days that somebody, goes from either testing positive or having an exposure to having, at least in the case of testing positive, having these 2 negative tests before returning to the workplace. Now, as far as I know, those are guidelines, are not hard and fast rules. As a matter of fact, I know that some employers.
Gary, let me touch on that.
Sure.
For restaurants, Executive Order 2020-68 requires restaurant employees, if they've tested positive, to have 2 negative tests after 24 hours to return to work. So that's just for restaurants.
Okay, great. Well, good to know, because in certain industries, which provides some level of discomfort to the general public when they hear about it, and in certain areas where I guess there's been a decision made that employees are needed more, is that we've got some people in the healthcare industry which have less onerous return to work requirements than the restaurant and hospitality industry. So it's important to understand what kind of industry specific implications that you need to deal with, because you may have heard of somebody, well, certainly if they're in the healthcare field and we do what they do, we'll be fine. And this case, that wouldn't be true, even though it's seems intuitive that we would certainly require the most from our healthcare workers, and evidently that's not the case, because a decision must have been made that we need these workers too badly to set the bar too high. And with hospitality and industry, that the thinking must be, well, this is something that we've newly opened, and we're going to set the bar higher so we can keep these businesses open longer by having these more onerous requirements.
Okay. Thank you very much for that, Gary, and really all the answers here have been very helpful, I'm sure, for our attendees. I don't see any more questions, so we will be sending a follow-up email later today with links to the CDC guidelines as well as other resources for your reference. On behalf of the Chamber's Tourism and Hospitality Council, I would like to thank our panelists, Nicole Chapman of the Florida Restaurant and Lodging Association, Gary Wheeler of Consanji Brooks Smith and Profit, and Michael Schmitz of Workplace Synergistics for sharing their knowledge and expertise with us today. I would also like to acknowledge Kathy Newman and Andrea Knight with the Chamber They really are a huge help in putting these calls and meetings together in a difficult time for all of us. So without them, this wouldn't be happening. Today's discussion was recorded, and the recording will be uploaded to the Chamber's website for playback at a later date. I invite you to visit the Chamber's website at www.sjcchamber.com and follow the Chamber on Facebook, LinkedIn, Twitter, and Instagram for information and resources to assist you through this crisis and into recovery. Thank you to all my fellow Chamber members and to all of our guests for your participation in today's webinar. May you all have a very happy and safe 4th of July. Thank you so much.
Thank you. Bye-bye.
Take care.